I am now privileged and honored to represent an incredible ally to all healthcare workers in California and around the country. Jim Manja made the tough decision to stand with the workers in his facility and allow them an organized voice in the delivery of care in the clinic that he runs. And he was willing, I think just months ago, to sign an agreement that was called a card check agreement. How many people know what that is? That's the most sensible way that non-union workers get a chance in delivering the care that they so deeply desire to deliver each and every day to the people we serve. And Jim had the sense to honor that calling that every healthcare worker has by reaching an agreement with our sister local, SEIU Local 7-1, in recognizing them through card check. And I think Jim's dad, knowing what I've now read about his father, would be incredibly proud. Because his dad organized the taxi cab drivers union in New York. And then, yeah, isn't that great? And then when he went to protest at a rally, they were clubbed by the police. And so Jim comes with a deep understanding of what working people face when they try and form a union, and an incredible respect for working in partnership with healthcare workers, which is what we are going to insist for all healthcare workers across this country. Jim, thanks for joining us.
Thank you. Thanks so much.
Okay.
Thank you very much. It's such an honor to be here. I'm truly humbled and so moved by this assembly and you allowing me to address you today. I wanted to just begin very briefly by sharing why we decided at St. John's that it was the right of our workers to unionize. You know, the community clinic world, it's a nonprofit world, and our margins are really, really small. And so everybody's, you know, a lot of the clinic leaders and all the corporate healthcare leaders are always kind of whispering in our ears, the health insurance industry, and they're always saying, you know, you guys are so, you know, you do such amazing work and you serve so many people, but, you know, your margin is so small, and if you unionize, the union's going to break the bank, and you're going to go bankrupt, and you're not going to have the flexibility you need to provide health care to the hundreds of thousands of people that you do. And I said to myself, when Kathy Ochoa, who's a longtime leader in SEIU Local 721, came to me and said, what do you think about building this partnership? And I said, I want to build this partnership for two reasons. One, because I want to show that a community clinic will fly in the face of this propaganda, because the healthcare workers are the people who are best suited to know what quality of care is. You know, I raise the money, I help build the organization, I make the political connections, but I'm not there on the front lines every day serving 120,000 patients that St. John serves every year in South Los Angeles, one of the poorest communities in America. And so it's the workers that have to tell me what it means to provide health care to this community, not the other way around. So that was the first reason we decided we had to unionize. The second reason was because President Obama said that we had to reorganize our healthcare system to make sure that prevention and primary care were at the core. And he said that community health centers were the foundation of primary care in America. If that's the case, then every community clinic in the United States of America has to be a unionized clinic. So, with that said, you know, I walked the picket lines with my dad and my uncles. We were clubbed by police officers when I was 11 years old, when Annenberg broke the typographical union in New York City. And so this partnership between the provision of health care, between the community clinics and the hospitals and the union is going to transform the delivery of health care in America. And I'm really honored, I'm so honored to be here and honored to be with you, sisters and brothers. Thank you so much for having me. So, as you know, we serve South Los Angeles, and I'm going to give you a sense of the crisis in South Los Angeles of health care and the conditions of the people that live there. But our doctors pull cockroaches out of the ears of 25, 30 children a week because of the slum housing in which they live. This is unacceptable in the richest country ever known on the face of the planet. There should not be poverty, and if it wasn't for the labor movement, there would be so much more poverty in America, and the labor movement must take credit for making